Hi, I'm Dr. Goddard. I'm here with Dr. McCauley, and I have the practices in Knoxville, Tennessee, as well as Miami, Florida. It's called the Osteopathic Center. We're here today to talk about the O-shot. I've been doing regenerative medicine for approximately 10 years, and have partnered with Dr. McCauley so we can take the expertise from him and put it with regenerative medicine so we can provide the best experience for women as far as results and giving the best procedural experience as well. So I'll give it up to you.
Thank you, John. My practice is in Knoxville, Tennessee, and I've been doing obstetrics and gynecology since 1984. Over the last year, since Dr. Goddard and I have met, I've become well acquainted with regenerative medicine, especially when it comes to the field of gynecology. We have issues with intimacy, orgasms, female menopausal problems, all sorts of different things. Intimacy issues and orgasms become more of a problem as we age. That happens to both men and women, but as we age, we have a little bit more time, and what we found is that 60, 70, maybe even up to 80% of men and women are still sexually active well into their 70s, so sexual activity is still a very important part of aging. That being said, if the intimate experience is suboptimal, it becomes less important and will frequently become more of a problem for these couples, men and women, and just really about anybody. The intimacy issue, however, can affect any age, whether you're in your 20s, 30s, 40s, 50s, it can affect anybody. So there's a regenerative medicine shot called the O-shot, which uses platelet-rich plasma. And that's really the clear part of your blood. When you spin down blood, you get the red blood cells at the bottom and the yellow stuff at the top. That's what we use to inject to enhance the blood vessels, the nerves, the performance of the intimate experience for women as well as men. Would you agree?
Definitely so. Platelet-rich plasma is getting the platelets and putting them in high numbers so we can inject them and they actually start regrowing tissue. So I've done this for a long time where we regrow joints and tendons and ligaments and muscle and even helping nerves to regenerate to some degree. And so now when we apply it to the field of women and the intimacy issue or even some medical issues, we can actually regrow tissue and help the body to regenerate, to take away some of these medical issues, but also provide sensation that may or may not have been there before, or to make it even better. Then we even get to another level of this called stem cells. And whereas platelets are recruiting stem cells to heal tissue, we can also inject stem cells directly to the area and get an even better effect from this as well. And just seeing how we could work together between his expertise for what he's done for so long, and then putting the regenerative medicine aspect to get the best results. Now, about the procedure itself, how would you go through each step?
Well, the procedure was created or designed by Dr. Charles Reynolds, who is in Fairhope, Alabama, and it's called the O-shot. There's a counterpart called the P-shot for men. For the women, the procedure is really relatively simple. We draw a tube of blood, get about 10 or 11 cc's of blood, we spin it down, and after we do that, we use something called BLT cream. It's not what you think. It has nothing to do with food. It's a type of anesthetic that uses short and long-acting topical anesthetics to make the area numb. So you apply that to the external genitals, specifically the area of the clitoris, and after about 30 to 45 minutes, it makes that area very numb. So when we inject xylocaine into the clitoris and follow that with the platelet-rich plasma, it's minimally uncomfortable. Following that, there's an injection of about 4 to 5 cc's of platelet-rich plasma, which is also activated with another chemical called calcium chloride. We inject that in the area underneath the urethra, close to where the theoretical G-spot is located, and it fills up that potential space that's between the vagina and the urethra. Placing that there helps regenerate those nerves and stimulate the growth factors, help stimulate all the tissues to become more sensitive so that the intimate experience in that particular area potentially is enhanced. So you're enhancing the experience at the clitoris as well as the genital opening.
I think you said it perfect. Well, I look forward to helping people out and working with you. And, please call us and see if we can help any type of symptoms you may have.
Appreciate it. Thank you very much.